Well, aloha and good morning, Hawaii. Thanks so much for tuning in. This is Spotlight Hawaii. I'm Ryan Kalesuji, joined by Yanji Denise. It is January 20th, a historic day for our country. Just earlier this morning, Joe Biden was sworn in as the official president of the United States, joined by the first female vice president, first woman of color. Of course, now Vice President Kamala Harris. A very historic day this morning, Yanji.
Absolutely. Bright and early for us here in Hawaii, getting up. I know so many of us waking up to watch those speeches and watch the ceremony. It looked very different, everyone in masks and not a lot of folks there, but some beautiful images of the Washington Mall. You saw all the flags for all the different states represented, and you did see some notable moments with right there, a wonderful picture from this morning, Ryan.
That's right. We can see our two senators representing Hawaii, Senator Schatz and Hirono. They're on the steps of the Capitol, as you mentioned. A lot different this year because of COVID-19. Fewer guests allowed to be there in attendance right now. Of course, they are going through the inauguration parade. That also looking a lot different. But one of the things that many were concerned about was any possible attack or any terror threat that would happen during the inauguration. Thankfully, it has been a quiet morning thus far on that front.
Absolutely. And right here at home, there were some concerns about things happening at state capitals. That has not materialized here in Hawaii. If you do happen to go out, or if you go to the Star-Advertiser's website, you'll see that the lawn of the Capitol here is adorned with many, many flags. But other than that, no protest and no signs of any threat. So a beautiful day here in Hawaii and a beautiful day in our nation's capital, turning over a new leaf as we welcome the 46th president of the United States.
And also today, a very important day at the state legislature as they open up for this legislative session. Of course, a number of issues will be in front of the legislature this coming session, dealing with COVID-19, the economic impact of the pandemic, as well as a host of other issues in front of the state. So lawmakers will officially be gaveling in both the House and the Senate. And there won't be the usual pomp and circumstance that we see on opening day at the Capitol as well. That has also been scaled back. They're getting right to business, dealing with, of course, the budget and all those other issues that come with COVID-19.
Yeah, and one of the things that we've heard time and time again is the importance of contact tracing, testing, and of course, social distancing and mask wearing, but that contact tracing piece is what we really want to talk about today. We want to talk about AlohaSafe Alert, which is an app that is available now statewide that, Ryan, really could make a huge difference. Joining us to talk about that this morning is Lynelle Marble, the Executive Director of the Hawaii Executive Collaborative, and Brandon Kurisu, the President of IO Digital and founder of AlohaSafe Alert. Thank you both for being here. It's amazing to think that something on our smartphone could make such a difference. Brandon, we know that you were involved in the development of this app, so please tell us how it works.
Sure. Well, AlohaSafe Alert is based on Google and Apple's exposure notification technology. And, in the beginning of the pandemic, Google and Apple, they joined forces and developed this technology to help fight COVID. And know it or not, but this technology has already been embedded in the operating system of your device, of your Apple or Android device, through one of the updates maybe a few months ago that you installed on your phone. So the way it works is, devices that have the app are anonymously communicating with other devices in the vicinity using low energy Bluetooth. And what it's doing is it's sending random gibberish codes to each other. And in doing so, it's measuring how far apart you are, how unobstructed your interaction is. So, is there a wall in between you, or are you fully exposed? And how long your interaction is. So, if you were to be tested and confirmed positive, the other devices that your device has communicated with, if it meets a minimum exposure criteria, will receive an alert on their device saying that they may have been exposed to someone that tested positive for COVID. So, that way they can self-quarantine, get tested, or consult with their physician.
And Lena, how long does that information store in terms of you let's say the four of us are, of course, in a area together. We make contact. We're in a meeting. I find out a few days later that I test positive. How does that work in terms of the notification? How long of a period does that time have between the initial contact to when someone gets tested positive?
Thank you. First of all, thank you, Yunji and Ryan. It's good to see you. We appreciate you having us on the show. So the application holds information on your phone for 14 days. And again, as Brandon had mentioned, it's completely private. It's gibberish code, so it's not identifiable to any person or location. But what it does is it exchanges these different codes. Should someone become infected, what happens is the Department of Health has that list of daily cases that they normally get. And now there's an automatic system that is set up where the people who have tested positive will receive a text message from the Department of Health instructing or asking them to send their result through the application. Once they opt in and they do that and they share that anonymous positive result, it then triggers the alerts to all of the different phones who would then get that alert saying you may have been exposed to COVID-19.
What's interesting about this is that you don't necessarily need to even know the person. It could be someone that you might be sitting next to on a bus. So, unlike contact tracing where you try to think of, okay, who was I with and where did I go? Brendan, tell us about how this sort of captures more people who you may have been exposed to.
Yeah, the Department of Health, they've been very supportive of this technology because for one, as you mentioned, it catches unknown contacts, people that, you may not have known that you were exposed to. It also enhances and complements the existing contact tracing process. So, a lot of times now in the standard contact tracing interview, patients, they have fevers, they can't remember who they interacted with. So this technology can help to address that issue as well.
And Lynelle, also back over to you. Talk a little bit about the development, I guess, of the app here, specifically in Hawaii, and how it has the partners that were involved in making this possible. How long has this app been out there, and what are you seeing thus far?
Sure. The app was really developed through a public-private partnership. It includes AIO Digital, of which Brandon runs, PathCheck, which developed that technology or the code around it, which is an organization, the spinoff of MIT. And then, of course, the Department of Health and organizations like the Hawaii Executive Collaborative, which is where I'm from, and groups like Everyone. So it really is the private sector and public sector coming together to develop this application. What we've done, while it's run by the Department of Health, what this application does is really a community engagement piece. It's only as good as people download it. So DOH asked HEC and others to really help drive the adoption of this application. Right now, we have about 50,000 downloads, and our hope is to get to 150,000 downloads.
And if you did reach that threshold of 150,000, Lynelle, what kind of a difference would that make?
Yeah, so studies show from Google and Oxford, they did early studies, and what it showed is if just 15% of the population downloads the app, that it could decrease infections by 8% and deaths by 6%. So when you look at our population and the number of people who have smartphones in Hawaii, that equals to about 1 million. So if we get that 150,000, it could decrease infections by 8%. And, I think it's a doable goal, and our community really cares about each other. So our hope is that we even get beyond that.
And Brandon, we know that this is not an app that's, as you mentioned at the top, this is something that has already been included in the systems of Apple and Google. But this is not an app that is specific to Hawaii. There's other versions of this throughout the country and throughout the world. If you can explain a little bit about that piece and just the broad network that it's impacting.
Sure. Yeah. And Lynelle had mentioned earlier, but I think there's about maybe 22 states that have adopted this gang technology. And, an interesting thing to note is that the Association of Public Health Laboratories, or APHL, they are hosting a national key server. And what this means is that all of the states that have their, Google and Apple exposure notification app on this server, their apps are interoperable with AlohaSafe Alert. So, say for example, somebody from New York who's on this server, somebody from New York comes to Hawaii and visits family and friends and spends maybe like a week here, goes back to New York, doesn't feel well, tests positive in New York. The people in Hawaii that they were interacting with, should they meet the minimum exposure, they would receive a notification, even though this person is in New York and they're in Hawaii. And there's a list of about 20 states that are on this server: California, Nevada, New York, Washington. A lot of the West Coast states are coming on as well.
Lynelle, tell us about that visitor piece and what Maui is doing to try to capture those folks as well.
Sure, so our hope is that, again, as Brandon had shared, that anyone can download the app. Of course, it's available statewide. But what Maui decided to do, Maui County, was to mandate the download of the app. So now when anyone comes in, any traveler coming into Maui County, in addition to the Safe Travels form, they'll be asked to show the application or their state equivalent of the app.
Brandon, I'm wondering, there is obviously some hesitation by some people in the community out there about just technology in general, about tracing and people knowing where they are. Have you run into any of that hesitation by people and having to dispel maybe any rumors or ease any sort of trepidation about installing an app that tracks people around them?
Yeah, that's probably been the main issue that we've had to educate people on. And, as Lynelle had mentioned earlier, AlohaSafe Alert is built on an open source framework from the PathCheck Foundation. And, they are a nonprofit organization out of MIT. And, from the beginning, they've been working with Google and Apple and did, extensive security audits and testing to ensure that this application is secure. And also, Google and Apple developed this technology with privacy and anonymity in mind. So as I mentioned, it just uses low energy Bluetooth. It does not use GPS. So, the application doesn't know, where you are, and it doesn't track anything. Everything is very anonymous and secure.
To that end, let's go back to the scenario that Ryan posed. The four of us hang out. Later on, he doesn't feel well. He tests positive. When I get that alert, what does it actually tell me? Does it say Ryan has tested positive? Does it say someone you know? Can you tell us about that system? Because I think some people might have some trepidation about having their name out there associated, with any kind of test result.
Yeah, it does not identify any person. So you just simply get an alert on your phone, much like a notification from a news station or a weather alert that basically says you have been or you may have been exposed to COVID-19. And then what the app does is it walks you through a couple of trackers for you to monitor your symptoms. It makes recommendations around calling your doctor, isolating, just to make sure that you can get yourself isolated before trying to expose anyone else. And maybe Brandon, you can talk a little bit about the timing. It does talk about, within 3 days or 5 to 7 days. If you could share that, Brandon.
Sure. So, as I'd mentioned, that there is a minimum exposure criteria. The worst thing that the Department of Health they want to prevent false notifications. So they set a threshold of what constitutes an exposure. And it's a standard 6 feet or less, 15 minutes cumulative exposure time. And if the exposure or interaction was within the patient's infectious period in the last 14 days. So it's not everybody in the last 14 days would get an alert. They have to be within the infectious period, which is determined by the symptom onset date or the test date. And every state can play with this algorithm. It's a risk scoring algorithm. So DOH kind of has their own, and California might have their own. There's a wider net you can cast, or to keep it a little more narrow to be more precise.
And just for the user sense, I guess, Lynelle, I mean, basically, there's not a lot to it, right? I'm assuming that you would just download the app, maybe insert some information, and other than that, you don't really need to open it daily or do check-ins or anything like that. I mean, the only time that you may actually use it is if you've essentially been exposed.
Right, that's correct. It's really simple to use. You just go to your app store, either Google Play or your Apple Store, download the app, it's free. It takes you through a couple of screens around access for Bluetooth, and then you leave it. It's kind of a set it, forget it situation. And then only if you are unfortunately tested positive for COVID-19 will you have an action to take to share that notification or that positive result anonymously. Or again, if you get that alert that you've been exposed, that's when you would take action.
Brandon, at the top, we were talking about how the goal right now is 150,000, but let's look beyond that, because when I was reading about it, it just was pretty striking that if we actually get to a vast majority of Hawaii residents adopting this, we could really slow down the spread of the pandemic. Can you tell us some of the projections as more people adopt it, what could happen?
Yeah, as Lynelle had mentioned, I think our goal is 150,000 downloads, and that's about 15% of the smartphone owning population, according to some of the research that we've done. And 15% adoption in the community would result in 8% decrease in infections and a 6% decrease in the death rate of COVID.
Right. And if we got to 80%, I was reading that we could essentially stop the pandemic in its tracks.
Mm-hmm. Yeah, and I think a good, what we need to emphasize is this is yet another layer of safety. So it's not going to be the silver bullet to stop the infections. Those statistics are based on adding it onto the measures that we are already taking. So mask wearing, washing hands, social distancing, no large gatherings. If we continue that and add the application onto it, that's where we can get to those numbers around decreasing and ultimately stopping the spread.
We do have a question that is coming in from Frank, who's asking, how well does it work if you're using other Bluetooth devices? I'm assuming that, you would want to have it on your phone primarily, because that's what you keep on you most of the time. If you have, say, an iPad, I would imagine that you're not necessarily carrying that everywhere that you go. Is that correct? I mean, I'm assuming that the phone is the most accurate point for this particular app. Would you say so, Brandon?
Yeah. So the application does not work on tablets, iPads. It just works on mobile phones, and I think it's iOS version 13.7 or later, and Android version 6 or later.
Okay. Well, Lynelle, just one more time, if you could walk us through, because I downloaded this a couple weeks ago, and honestly, I haven't, other than preparing for this, it was, as you said, I set it and forget it, and I honestly forgot that it was even on my phone. And it is really, can you sort of walk us through again how to get it and just how easy it is?
Sure. Just go to your store, your Google Play Store or your Apple Store. Look up AlohaSafe Alert, download it for free. And then there will be a couple of consent screens ensuring that you are enabling your Bluetooth and opting in. And then you just leave it. If you're concerned or worried if it is on, you can open up your app and there will be like a little green check mark that says you are you have Bluetooth on and you are allowing the app for exposure notifications. So, and then that's it. And then again, the only time you'd have to activate it further or do something is if you become infected and sharing that result anonymously, or if you get an alert saying that you've been exposed.
And we do also want to bring in another question that we just got from Julie here that says, are you required to go into quarantine if pinged as a close contact? Brandon, if you can talk us through the process of what someone who has, who does get an alert that they have been in close contact, what they experience and what sort of direction it provides for them moving forward.
Sure. If you do get an alert, it takes you through a kind of a screening tool where it asks you what your symptoms are, how you're feeling, and depending on how you answer that, we provide CDC recommendations based on your answers. So it could say to self-quarantine, it could say to call your physician, but it doesn't say you have to self-quarantine.
And if you are positive, then does the app kind of track where you then go after that? Because if you are a positive case, does it know that maybe you're not in quarantine and that you're continuing to be out in the community and spread?
No, the app, it does not use GPS, so it doesn't know where you are. Everything's completely anonymous.
Okay.
We also, oh, sorry, go ahead.
No, go ahead. Go ahead, Lynelle.
No, I was just going to say that, we've been doing a lot of outreach in the community, and one of the groups that we talked to are a number of physicians through the different physicians groups like PNAG, and these physicians have come on board. They had a lot of tough questions, but they realize now the value of the app. One of the physicians that we've worked with, Dr. Chalk, has talked about how valuable it is because he gets a ton of calls daily around people who are afraid that they might have been exposed. So he has to go through a longer process before figuring out if they need to get tested. But he said now if people or his patients call and say, I've got an exposure from AlohaSafe Alert, he then has the confidence to tell people to get tested right away and to go into isolation. So this app is also helping, can hopefully help the medical professionals to make quicker decisions around helping their patients.
I know our time is coming to a close, but Frank wanted to clarify his question. His concern was that if you use multiple Bluetooth devices, so let's say you're using your earbuds, which are connected via Bluetooth, and you have the app on, does the using other Bluetooth from your phone interfere with the effectiveness of the app? That would be for Brandon.
We haven't seen anything like that, so.
That's good.
So that's good. So it works.
Yeah.
All right. Yeah. So if we, as we wind up here, if you want to just provide one final thought about the app, the importance, Brandon, we'll start to you. Just your overall thought about how things are going thus far and your vision for moving forward with this app.
Yeah. We've been really pleased with the engagement and adoption so far. We have about 50,000 downloads, and our goal is 150,000. So we're confident that we'll get there with a lot of the promotion that we're doing and outreach now. And I did want to mention that we have a website, AlohaSafeAlert.org. It has a lot of the information there, a lot of the FAQs, and we also have a supporter toolkit where we have social media images, one-sheet flyers, QR code posters. So we encourage everyone to download the toolkit and share the app with everyone.
Okay. And Lynelle, did you have any final thoughts? We know that AGC, of course, is a close partner in all of this and working with many partners and many different organizations and business leaders. Your thoughts moving forward with this app on behalf of HEC?
Sure, thank you. I just want to first thank all of the partners that have come on board. People like or businesses like Hawaii Pacific Health, Queens, Hawaiian Airlines, the union groups. So many people have embraced this app and are sharing it with their employees and with their customers. So again, I think I mentioned this is only as good as people adopt it and opt in. And you know, Hawaii by nature, we really care for each other. And I think this is another way that we can do that, especially as we wait for vaccines and try and come out of this pandemic.
Okay, thank you so much. Well, Lynelle Marble from Hawaii Executive Collaborative and Brandon Kurisu of IO Digital, thank you for being here and talking to us about AlohaSafe Alert. And please do, if you're watching, download the app, because as Lynelle said, the more of us that do it, the more effective it is. Thank you so much for being here.
Thank you so much.
Thank you.
Thank you both. We can see here again, this is the information that you can see there on the bottom, AlohaSafeAlert.org. Visit that website, or again, download the app on your smart device. Some interesting stuff out there, Yunji. I know that you mentioned that you downloaded, I downloaded it as well. And really, it is pretty simple in terms of the setup. And as they say, you just sort of set it up and let it go.
Yeah, and you know, I actually, after downloading it, I did feel better, because you know, you worry about, okay, I go to Costco or I go to the grocery store, and who am I interacting with, and am I being exposed by someone who I would not necessarily get contact traced back to? So this is another, you know, tool in the arsenal, if you will, in the fight against COVID-19. There's an article today, the lead story in the Honolulu Star-Advertiser, about the shortage of the vaccine. You know, we're all waiting for our shots, but in the meantime, we need to wear a mask, socially distance, and then if we can, if you have a smartphone that has the capability, please do download this, because it could make a real difference in stopping the spread. Just that 15%, imagine reducing infections by 8%, reducing deaths by 6%. If we got to that 80%, which I know is a long shot, but could eventually get there, it would be enough to suppress the pandemic on its own without other intervention. I mean, that is just incredible to think about.
That's right. And I think one of the key highlights in all of this, as Brandon had mentioned, is that it's using this technology that's not necessarily taking any information. It's not, invading your privacy, so to speak, or tracking you with GPS location. It's using what they call, I believe, gibberish communication of some sort, to talk between phones in order to get this information out and make sure that it's communicating with other devices. And so privacy is not an issue here in terms of what people are sharing through the downloading of this app. And also interesting to note, as he mentioned, that other states are participating in it as well. So when visitors come, or when we could potentially go to another state and be around someone that is infected there, we would also get that notification for those who have downloaded their version of the app on the mainland as well. So a lot of cool things happening with technology as we continue to see how this pandemic is impacting our community, but also how it is sort of reinventing ways and practices and using technology to help us get through this time.
Absolutely. And we're going to be talking with more leaders in the days and weeks ahead. On Friday, we have Honolulu City Council Chair now, Tommy Waters. He's the new chair of the council. And what will be interesting about that also is that there are 5 new council members. So we're going to be talking to him about his agenda, talking with him about the agenda going forward, his relationship with the new mayor, and sort of all that the city can do in stopping the pandemic and also in lifting up the economy.
Yeah, interesting to note that relationship between the mayor and the new city council. We'll talk to Councilmember Waters about that. We'll also be speaking to the new mayor, Rick Blangiardi. That will be happening next week, of course, along with Governor Ige. And we're also lining up a number of guests as we head on into this next month, into February, which will include Senator Brian Schatz to give us an update on all that's happening in Washington, D.C., as well as officials from Hawaii Pacific Health to talk about the vaccine rollout. So a lot of things still happening here on Spotlight Hawaii. We certainly thank all of you for being a part of the conversation. Again, remember, download the app. You can find more information at AlohaSafeAlert.org. But if you Google, look up AlohaSafe on your phone, on your mobile devices, make sure you download that app to help us in this battle against COVID-19. We'll see you right back here on Friday for another Spotlight Hawaii at 10:30. Aloha.
Aloha.